Hello, everyone. Welcome back to another installment of The Political Patient. I'm Shreyas and I'm here with Anusha. And
Hi
today
everyone.
we're going to be talking about Biden's Build Back Better that he ran his campaign on and the infamous the set of legislations that he wanted to pass in 2021, um, and what its implications are for health policy and what its update net sort of is. So recently on Fox News, Senator Manchin shared that he opposes Build Back Better, rendering it almost impossible for this bill to be passed now. And that's just because of the way the Senate is split at the moment, with the 50-50 split in the tiebreaker being Vice President Kamala Harris. But that's not necessarily what we want to talk about today in the sense of why it's not being passed, which again, a lot of it can be, I guess, traced back to Senator Manchin, but that's not the point. What are the health policy implications of that now? So obviously, Build Back Better was a very an expansive initiative, and a part of it dealt with health. The first big thing is that premium subsidies, or the federal enhancements for these premium subsidies, will now, for the Affordable Care Act, now need to be passed in like a separate legislation. Luckily, Senator Manchin did share that he would be willing to like accept such a proposal in 2022. So there is a chance that this will be passed, but not through Build Back Better. And the other thing is, now that the government needs to try something different in order to tackle the high prices of drugs and just prescription drugs in general. Um, at the moment, there is like the writing per se of Medicare does not allow for any fighting against these high drug prices, and therefore a new law needs to be enacted, which is what Build Back Better hoped to do. But with that now not being able to be passed, this would need to come out as a separate legislation. And it seems that Senator Manchin noted that he might support such a package in 2022. Regardless, a big theme now is that with President Biden's midterm elections coming up, and just the Democratic Party having to run again per se, um, the country does desperately need some sort of initiative to be passed, some sort of large scale initiative to be passed by the Biden administration, not just so the Biden administration can hold on to any power that they do have, but also because the people need help right now. And the Omicron variant um, is not helping situations at all. Hospitals are near full capacity or at full capacity or past full capacity, don't even know how that even like manifests, but it's just not doing well at all. And um, the hospitals desperately do need some sort of more guidelines and funding and things like that, or a variety of different hospitals, just because even healthcare workers are now at extremely high risk with the Omicron variant, because we're seeing that it's extremely transmissible. So yes, we need some action, and Build Back Better can't be it for 2021, it seems. What are your thoughts, Anusha?
Yeah, it seems like it's not going to build back better. It's just build whatever we hope is going to pass because the Senate is so split. Like the issue here isn't the House because the Democrats do have the majority there. It's the Senate and the fact that it's such a divisive split that they have no way of bringing over any Republicans. So now they're focused on their own party. And personally, paring back a lot of the programs has been in the news, I feel like frequently, is going to cause even more contention among the so-called progressive members of the party and the so-called moderate members of the party. It's worth mentioning that while Manchin is the one getting the most headlines and the one who's being the one person against this entire bill, which is accurate to some extent, the progressives and the moderates in the party aren't helping things by any means. At this point, it's kind of, I think a lot of people are just frustrated with the party and with the way things are going. I mean, the midterms are in 10 months, right? November. So, in 10 months is not a lot of time considering how quickly 2021 seems to have flown by, right? So, if the Democrats don't put something together quickly, then the Republican Party is naturally going to win. And I think you and I can both say that's probably more on the Democrats than it is the Republicans. I mean, at the end of the day, it's about working within your own party and compromising with your own party members, especially if you know the other party isn't going to listen to anything you say, regardless of how many bipartisan moves you make, right? Maybe it'll switch around, and if the Republicans take the majority next election season, then they're going to be dealing with those issues in their own version. We just kind of go in a cycle, but hopefully Democrats will be able to break that cycle for now. It's worth mentioning though, like when you talked about like holding down drug prices in Medicare, you're absolutely correct. The current law doesn't allow Medicare to negotiate drug prices, and Manchin himself has said that he wants to fight high drug prices. So like there is room for compromise here. Like it seems clear to me that any sensible political leader would want to lower drug prices, right? And I think if we just kind of tackle those points of like, compromise first and then get to the points of contention, hopefully we can help more people quicker rather than just kind of being like, actually, we want to do this, this, and this, but this is our only point of similarity. At the end of the day, it's going to have to be compromised if this is a democracy. And then the one last thing I wanted to point out with the Omicron variant is that, yeah, essential hospital workers are already in short supply. And like, it's not even that like, they're being hospitalized and like dying, right? Fortunately, we have the vaccine. The vaccine has been proving pretty effective against the Omicron variant. Naturally, go get your booster shot because it's been shown that the efficacy grows with your booster shot. But it's about, for example, say like 6 hospital workers in like a 10 hospital worker ward, just like for hypothetical sakes, go sick and have to be at home, and like the other 4 have to pick up the slack. That's what we mean when a hospital is being like surged or is at full capacity. It isn't about workers like dying left and right. It's there's no longer anybody in the ward to take care of the patients, and the remaining people who are there in the ward are becoming overwhelmed, burnt out, and are ultimately, a lot of them are just leaving the hospitals themselves and becoming, like, for example, traveling nurses. Some are quitting healthcare altogether. Some are taking gap years, for lack of a better word, and like just time off. And that doesn't bode well for healthcare system as a whole, I feel like. But yeah, I think the one other big thing I wanted to point out, Trace, which is interesting, is that the drug, I believe it's Aduhelm. I don't know how to say it like properly. But it was approved this year. It's a drug that's going to hopefully treat some Alzheimer's cases, and they cut the cost of the drug to about $28,000 a year, which is, I mean, considering, it was 56,000, earlier, yay, I guess. But Medicare has not like yet been like proven to cover it yet. So we're going to see at least next month whether or not that's going to be covered. So stay tuned, because that's a pretty cool drug that's coming out to help hopefully treat a very nasty disease.
Yes. And again, like the hospitals being at full capacity or close to capacity, there's many different ways you can picture how that's going. Another really good way to understand what's going on, and this is exactly what's going on. There aren't enough beds either, and which is obviously problematic if you are dealing with COVID-19 and you need the help you need to get in order to overcome that issue. But also, a hospital does not just deal with COVID-19 patients. It deals with a variety of different conditions, whether unexpected and you need to make a visit to the hospital, like the emergency room per se, or just your monthly, annual, every few years visits that are already scheduled that now are having to be canceled, which put many people at risk. So yes, hospital workers are being overworked. They are often leaving, or they're not able to come into the hospital. And on top of that, their hospital resources are also being finished. But that being said, like Anusha mentioned, not everything is bad news this year or the past few years with COVID. the announcement about Aduhelm for the Alzheimer's drug is a step in the right direction. That being said, there need to be more steps in the right direction, but yes.
Yeah,
So that,
absolutely. And I think the one last thing, maybe just in terms of like fun things for 2021, good news, the vaccines, I feel like are like the huge, like pat yourself on the back from all scientists who worked on this, because I think I said this last episode, so I'm not gonna like reiterate my point more, but like it really was a miracle of science. It truly is incredible. I would recommend going and reading maybe one of her articles on pill policy about the history of the mRNA technology on it, or doing your own research to understand like how it was just this Hungarian scientist and this one epidemiologist who came up with this technique, and now it's being used to save like millions and millions of lives like around the world. So
yes, go science. Okay, well, that is all for today. Thank you so much for listening to today's episode of The Political Patient, and hope to catch you guys later.